The following segment is sponsored by Palmer Distinctive Dentistry.
Welcome back. A local dentist here in Greenville offering you a beautiful smile in an atmosphere of comfort. Joining us this morning, we have Dr. John Palmer from Palmer Distinctive Dentistry. Thanks for being here with us.
Thanks for having me.
Absolutely. First, tell us a little bit about your background and why you're passionate about what you do.
Well, my background's like most dentists. You know, we all went to college. I went to Clemson. We all go to dental school. I went to Medical University of South Carolina. And I practiced the way they taught me. I was putting in fillings that had mercury in them. I was taking out fillings that had mercury in them. And I did that for 15 years. Somewhere along the way, I built up enough mercury, my health started going bad, and I got diagnosed with mercury poisoning.
Wow. And we'll get into that. I mean, that's probably going to be one of our recurring segments. You're at 134 Milestone Way, right near us. Right. Reading your reviews, I know that patients love to talk about the non-intimidating, the peaceful setting you have there at Palmer Distinctive Dentistry. How do you achieve that?
Well, you make it intentional. I mean, it's part of our culture. And you do it by finding great people. I found a great team. They care about people. They care about getting people healthy and helping them, and we listen to our patients. We train for it. So, I mean, it's our culture. We come to work to take care of our guests. And if you keep that in mind, the only reason you're there is to take care of our guests.
Serves you well, and it serves them well.
Yes.
You practice holistic dentistry. Now, talk to us a little bit about that philosophy for those who don't know.
Well, that came from getting sick from practicing not holistic dentistry. So holistic dentistry looks at what we do to fix people's teeth, knowing that it also affects the rest of their health. And it also kind of the other way. People's health can be caused by things that are wrong in their mouth. And so we treat dental infections, clear the infections up, we take out toxic materials safely, and we actually see people getting better.
That's a great thing. And you've been practicing mercury-free since 1995. You also offer the safe removal of mercury fillings. You know, what do you want people to know about that?
Well, when you have fillings, the dark silver fillings, they're called amalgam, they're half mercury. And they're always, some mercury comes off these fillings. But when you put a dental drill on them, and you create this aerosol that fills up a room of mercury vapor and particles that then go in your clothes, they go on the assistant's clothes, they get all over the dentist's clothes, and then they'll take all that stuff home with them, and there's a big exposure. You're breathing that stuff in. So we do the removal techniques. We prevent the patient from breathing it in. They're completely covered up. We dress in biohazard suits. They're breathing oxygen. Nobody's breathing the room air. And we have all kind of filters and machinery going to clear all that stuff out of the air as fast as we can. And I know it's there because I've done studies that prove it's there, and we've actually published one study that just the mercury that's left on the head of a handpiece, if it was in a school, it could shut down the school.
Wow. That's and it's something I think more and more people are learning about, more and more people are talking about it. We're seeing a trend towards alternative health care in general.
Right.
Because of that sort of thing. Holistic dental care extends beyond preventing, diagnosing, and treating dental diseases. You really want to get to know your patients and their lifestyles, is that right?
We do, and it's kind of interesting that when I was going along this path, and it has been a path, when we first started taking mercury out safely, patients would come in before that knew tons more than I did. You know, and I guess I was smart enough to nod my head and say, yes, I didn't know what they're talking about. I'll look that up. And then finally, I continued my education and made it intentional for me to learn what they were telling me. These patients are smart, they're frustrated, other practitioners won't listen to them, they think they're crazy, but they're not. We see chronic disease get better as we clean up the problems we find in their mouths.
That must be the most rewarding thing for you.
It has been. It really has been. It's kind of ironic because I chose dentistry so I wouldn't have to deal with sick people. And now it's come all the way around, and a lot of people that come in have medical issues that I'm helping. It is very rewarding.
You can't get away from that, but you're serving the people.
Yes.
Anything else about your practice you want to get in today? I know we'll have you back and we can get detailed on some of these subjects.
We can. I mean, we truly care about our guests. We treat them as guests. My practice is like coming into my home. And that's the atmosphere we do. I have two other dentists there that are my associates that have the same caring attitudes.
Good.
And we try to do the best we can and listen to people.
And that's the good experience that that your guests are talking about online about you. You can experience the difference too at Palmer Distinctive Dentistry. Call 332-4113 to schedule your visit. I know you offer one visit crowns, cosmetic dentistry options, as well as TMJ headache therapy. So a lot of areas for us to discuss.
A lot of different things, a lot of advanced technology.
Yep.
I've always been one of the leaders. I was one of the first 200 dentists in the country to start with CAD/CAM dentistry, which is the one appointment crowns back in 1997.
Well, fantastic. It'll be a pleasure to talk to you in future weeks, Dr. Palmer. Thanks so much for being here.
Thanks for having me. It's been fun.
We'll send it back to you in the studio.
All right.